That's so interesting to me that so tell me you're a chiropractor, right?
Licensed
Licensed
chiropractor. Yeah.
chiropractor, absolutely. And so I'm noticing that a lot of chiropractors like yourself, they're practicing holistic medicine now.
Mhm.
Why did you get into holistic medicine?
So I actually had my own health issues growing up. I got diagnosed with Crohn's disease when
Mm.
I was 13. And then I had other inflammatory and autoimmune conditions pop up, 19. And I was still functional, but after college, I actually went to work on Wall Street. And when I was there, things really hit the fan. And I went on disability at age 24 with all kinds of, probably like a list of 30 things that would send me to 30 different kinds of doctors in institutionalized medicine. And I just knew that there's no way there was no relationship between all these things. And so, things weren't working out. And I started becoming a patient of people in vitalism. And some of these people were chiropractors and some were naturopaths. And I decided that in order to save myself, I had to become active in my own healing, and I didn't want to be on the passive end of things. And so I went back to school, and I said, if I can heal myself and then help others heal, I think that would be pretty fulfilling. So that's how I ended up going to chiropractic school.
That's amazing. So do they teach you holistic health in chiropractic school?
Well, the meat of chiropractic school is going to be 90% the same of any other kind of healthcare profession, medicine, physical therapy, nurse practitioner, because the goal is mostly to pass boards. But the remaining 10% is clinical. In chiropractic school, the heavy majority of it is on the musculoskeletal system.
Mm-hmm.
It just so happens that there is no institution of functional medicine or systems-based healthcare. Even naturopathic school often is very much based on you have this condition and this is the evidence for this herb that can help this condition. But that's still not getting to the root that much, which is what is the etiology, what is the cause, the origin of these conditions, and what are the systems in interplay. So not a lot, some chiropractors will gravitate towards that kind of thing, maybe because they knew a chiropractor who was doing this kind of stuff. That's like me. And then there's naturopaths who do the same. So it could be a naturopath, chiropractor, osteopathic physician if they didn't go into institutionalized medicine. But really, there is no institution that owns holistic medicine.
This leads to my next question is where does institutional medicine fall short?
Well, okay. So where to begin? So there's pluses and minuses. I mean, I'm glad that institutionalized medicine exists, especially for acute care. I mean, if I have an acute infection or I break my leg, I don't want to go see a licensed chiropractor or naturopath. This is something serious.
Mm-hmm.
And so emergency care and acute care is really well developed in institutionalized medicine. And that's actually how it originated is institutionalized medicine really came from during the Civil War. Okay, so you know about this. So, a lot of physicians began doing surgery and acute care, and there'd be, medics on the field. And so that's really the foundation of institutionalized medicine. When it comes to chronic illness or chronic diseases, institutionalized medicine has more of an approach of managing illness as opposed to reversing and promoting healing. So if someone has IBS or constipation or Crohn's, they might be given drugs in order to forcefully cause motility of the gut, or they might give immunosuppressive drugs for Crohn's disease. But what happens in these individuals is they tend to get problems elsewhere because the root cause. And if you look at the research, the chances where you have one autoimmune disease that you're going to have another is just huge.
Huge. It is huge.
And it's because the root cause of what causes autoimmunity is never addressed. And so they just keep going on these autoimmune immunosuppressive drugs. But their sickness is just being managed. And that's where the phrase sick care comes from, and that institutionalized medicine when it comes to chronic illness is more about sick care, not healthcare. But that's just a semantics playground type,
Big
you're
pharma.
not, yeah. So
Big pharma. And it's so unfortunate because I do have to agree with you that every medicine has a side effect. And to heal one thing, there's always another thing. So there's so many people out there that are stuck on these meds and it's endless. And it's so sad to see people struggling like that. Where the cure, there's other answers, there's alternative, but people don't know the alternative.
Yeah, we don't grow up. Society has decided to communicate that, what you do is you wake up, you have your cereal, you eat your Wheaties, and if you get sick, you go see your medical doctor.
Yes.
The survivability of holistic medicine has purely been off word of mouth and demand, and that wouldn't be around if it wasn't for results. So
Yes.
I didn't grow up wanting to be a chiropractor or even knowing what
Right.
vitalistic medicine is. It was my own experience and how institutionalized medicine couldn't serve me with chronic illness that I fell into it. And that's what happens
Right.
with a lot of people.
And what the interesting thing about that is that we have leaned on the government to keep us alive.
Hmm.
And that's so unfortunate. We have
Yeah.
so much faith in them where, there's so many other alternatives.